Hey there, fellow counselors. Today, we're diving into an essential skill that can transform your interactions, building rapport using neuro-linguistic programming, or NLP. Whether you're in counseling, nursing, or even sales, mastering rapport can significantly enhance your relationships and communication. Let's break it down. First up, let's talk about one powerful technique is. This involves subtly mimicking the body language of the person you're communicating with. For example, if someone leans forward while speaking, you might lean forward slightly in response. This creates a sense of connection. Imagine you're a nurse and your patient is sitting with crossed arms and looking anxious. You might adopt a similar posture but then gradually relax your own. This can make the patient feel more at ease as they perceive you as relatable. Next, consider adopting it. This means uncrossed arms and facing the person directly. It signals openness and receptiveness. During a conversation with a family about their child's health, sitting up straight, maintaining eye contact, and keeping your arms open can help the family feel more engaged and valued. Speaking of, maintaining appropriate eye contact shows attentiveness and respect. Keep in mind, though, that eye contact norms vary across cultures. In a multicultural setting, being aware of these differences is crucial. Now let's shift to the adjusting your pitch and volume can significantly impact how your message is received. A calm, steady tone can convey reassurance, while a higher pitch might express excitement or urgency. When discussing treatment options with a patient, using a calm and steady tone can help alleviate their anxiety. On the other hand, a more enthusiastic tone might be appropriate when discussing positive outcomes. B is also important. Speaking too quickly can cause confusion, while a slower pace allows the listener to process information. For example, when explaining a complex procedure to a patient, speaking slowly and clearly can help ensure they understand. Pausing after key points allows them time to ask questions. Finally, let's talk about adapting your language style to match that of the person you're speaking with can enhance rapport. This might involve using similar terminology or adjusting the complexity of your language. If a patient uses technical terms to describe their symptoms, responding in kind can validate their knowledge and experience. Conversely, if they use layman's terms, it's often more effective to match that simplicity. Using helps create a more constructive environment. Instead of focusing on negatives or limitations, highlight possibilities and positive outcomes. For example, instead of saying, "You might not be able to do X because of your condition," you could frame it positively. With some adjustments, you can still enjoy many activities. And don't forget the power of open-ended questions, encourage deeper conversation, and show genuine interest. Reflecting back what the person has said demonstrates active listening and empathy. If a patient expresses concern about recovery, you might say, "I hear that you're worried about getting back to your usual activities. Can you tell me more about what specifically concerns you?" This not only shows understanding, but also invites them to share more. To wrap it up, building rapport using body language, tone, and language patterns is a powerful tool in any communicative interaction. By being mindful of these elements, you can foster a more positive and productive relationship, whether with patients, families, or colleagues. Effective rapport not only enhances communication but also leads to better outcomes in healthcare and interpersonal relationships. Thanks for watching. Don't forget to like, subscribe, and hit the bell for more tips on enhancing your counseling skills.